On September 28 and 29 of this year, the second Interdisciplinary Conference on the treatment and diagnosis of spinal stenosis will be held in Fort Wayne, Indiana. To that end, we will be presenting the surgical, the psychological, the motivational-based stress behavior outcomes, the conservative care of chiropractic manipulation, nutrition, interdisciplinary clinics. We will discuss chiropractors who are in interdisciplinary clinics and the nutrition of back pain. We will have urologists speak on the treatment of incontinence, both urinary and anal, that accompanies spinal stenosis so often. We will have implants, which you've probably heard of, surgical implants. When are their indications? What are their clinical benefits? Should they be used? To that end, on the conservative treatment of back pain, we will be having chiropractic presentations on the diagnosis and spinal manipulative treatment of spine pain. We will also have the University of Pittsburgh and their chiropractic and physical therapy departments speaking at this conference on Sunday to show their interdisciplinary approach to treating spine pain. When we discuss conservative care, we must keep in mind that well-written papers within the last year have shown that in order to avoid spine surgery, you must have the patient matched to a non-surgical spine specialist, someone who is attuned, who is accustomed to the most recent research and treatment of spine pain. And that raises this question: what is needed in spinal manipulation in order to have a successful clinical outcome? That is, relief of pain, increased muscle strength, and the ability to increase your activities of daily living. Well, there are four basic things that have been shown that are necessary if a spinal manipulation is to give relief and improve muscle strength. The first of these is a paper by Chung, which shows that distraction of a spine, which is what we do with our Cox technique. We distract a segment. And the effect of that is to increase disc space height, increase the size of the nerve opening, drop pressure inside of the disc to show reduction of a herniated disc, and take pressure off of the nerves exiting through that nerve opening into the extremities of the spine. The second thing that must happen by the work of Wang is that you must decrease stiffness of a spine. That is, we must increase the physiological normal range of motion of that spine. And to that end, this research done by Wang showed that one adjustment would not only increase range of motion and decrease stiffness, but resulted in strengthening of a muscle in the back called the multifidus, which lasted for 7 days. Another one of the changes that is important is that on MRI, you must see that there is an influx of fluid, nutrients, from the vertebral body itself through its end plate into the disc itself. This is important for the hydration and the nutrition of the disc. And when you see on MRI that this fluid is imbibing into the vertebral body from the nucleus and into the nucleus, you know that you are on the way to a successful clinical outcome. The next paper was published in Spine Journal by a man named Kuo and his group. And most interestingly, what they found is that when you do distraction manipulation, which is what we do and which we will be showing in live seminar at this conference, that what happens when we distract a spine is not only do we increase range of motion, increase muscle strength, increase nerve opening, but as Kuo showed, the distraction treatment is effective in enhancing the nutrient supply into the disc and promoting disc cell proliferation of the degenerated disc. This is something to be discussed. Do discs regenerate? What is the most important factor in the intervertebral disc degeneration? Is it the inner nucleus or the outer annulus? Research is showing us what? To be presented at this conference. It is the annulus fibrosis of the disc that shows the movement, the strength, and the histology, health of the intervertebral disc. So we will be demonstrating these facts that take place in distraction. We will be demonstrating the conservative chiropractic care. You will learn the physical therapy approaches to treating spinal and radicular pain. All be presented this, and the one last paper I present to you is that done by Huang. Huang shows that the effect of chiropractic manipulation on the matrix, the very structure of the intervertebral disc, shows that it may improve the degeneration in the wrap model of the disc in cervical neck disc degeneration by regulating the matrix, the very substance of the intervertebral disc, and influencing its metabolic health. So spinal manipulation and therapeutic exercise in treating post-surgical backs has been important. This will also be covered in this conference. So in essence, what we are saying here is we will show the changes within the vertebral disc that are needed to have a successful relief of outcome, increased range of motion, and nutrition of the disc when distraction spinal manipulation is delivered. This is something that is certainly growing not only in the United States but throughout the world with our work. Look forward to studying with you.